evening. As advertised, I'm not Julie McCrossin. Unfortunately, Julie is not well, so she sends you her apologies, and we send her our best wishes for a speedy recovery. So for those who don't know me, and there are plenty who do in the audience, I'm Dr. Alan Schell, Chairman of our Community Partnership Committee, and we run the Wellbeing evenings. And tonight I'm very pleased that you're all here to talk about healthy ageing, to listen to a very good panel of speakers and experts in the field. And as always, a Q&A means we'll have questions and answers. And I think that our speakers will probably give you plenty of answers for some of the questions you'd probably like to ask. We are part of the JCA community, and I think we'd like to introduce Bronwyn Elborn from Burgess Centre, just to talk about some of the things that our community does for our age. Please welcome Bronwyn, just to give a couple of minutes.
Good evening, everyone. Some of you I know and are waving to me, thank you. Just want 1 minute to just let you know the Burgess Centre programs. We run wellness programs that some of you may not be so familiar with, including yoga, Zumba, hydrosize, Tai Chi, strength and balance classes, as well as the probably more well-known programs that we have in terms of social support and wellness. So we've got brochures here tonight, so please pick one up on your way out, and I won't take up any more of your time. Thank you so much.
Thank you. So this evening, as part of support, we are here also to promote and support CHEBA, Centre for Healthy Brain and Ageing, and one of our guest speakers will be Professor Henry Brodaty, and he'll briefly talk about CHEBA and other things. We also have Associate Professor Lisa Pont, Dr. Nick Mills, and Professor Deborah Black, who will be our panel. We'll introduce them shortly, and we do have some audience guests as well. So in the first instance, I'd like to invite our panel to come and join us down the front. I'll introduce Professor Henry Brodaty, who I've had the pleasure of working with for the past 9 years, who's a researcher, clinician, policy advisor, dealing with people living with dementia and their carers in particular. And I think that he set up, and others with Professor Sachdev, the CHEBA organisation. So Henry would just like to have a quick intro on CHEBA, and then we'll get on with our Q&A tonight. Thank you. Should be on.
Thank you very much, Alan. So the Centre for Healthy Brain Ageing at University of New South Wales has a vision of ageing well without cognitive decline, without dementia. And we do a lot of research in trying to prevent dementia, to diagnose it early, to understand the cause of it, and to improve the care of it. The CHEBA website, which is cheba.unsw.edu.au, so University of New South Wales .education, in other words, edu.au, gives you a flavour of some of the research we're doing. We would have something like 30 to 50 researchers working on this, and some supported by government funding and a lot supported by philanthropy. So we're very grateful to the people who've donated to CHEBA. We've had some very generous donations, and we've been able to be successful with large research grants. Some of you may be participating in some of our cohort studies. So I met a lady in the lift coming here who's in our memory and ageing study. We recruited over 1,000 people from the southeastern Sydney area and have been following them up for 10 years. We're about to start the 12-year follow-up on those people, trying to work out what are the predictors of cognitive decline and what are the things that protect us from cognitive decline, from losing our memory, from losing our abilities to think and reason as we have it when we were younger. We also have a study of centenarians, over 350 centenarians, actually over 400 now, that we've been following up for shorter periods of time, for obvious reasons, and older Australian twins. So something like 600 twins or 300 pairs of twins, about half are identical and half non-identical. And these give us an insight into what is caused by inheritance and what's caused by the environment. So research is really a key to understanding what we can do about dealing with, preventing, or treating dementia and loss of memory and other aspects of decline in cognition, which is almost universal as we get older.
Okay, thank you. So we not only talk about the brain, we're going to talk about the rest of the body as well. And with that in mind, I think we should invite Professor Brodaty to talk about the big picture on ageing in general and some of the things that he's been working with all of us in research.
So, anyone here over 65? Yes. And getting further away from 65 every day. And about 15% of us are over 65 in Australia. And that's set to reach 25% by another generation. The numbers of people who are aged over 85 is going to quadruple in a generation. And the number of people aged over 100 is going to be 6 times larger by 2050. So we're a very rapidly aging population. We've gained over 100 years of lifespan between 1900 and 2000. That's remarkable. That's a quarter of a year every year for 100 years. And we're still gaining lifespan. Initially, that gain was through decreased infant mortality. So if the number of children dying, which was about 10% of all infants in 1900, and now it's about 3%, that's an enormous difference. But now we're increasing lifespan in people in middle age are living longer. And we're living longer, not just adding years to our life, but adding life to our years. We're living longer free of disability. So people can look forward to this golden third age. So the first age is growing up and doing your education. The second age is the age of your maturity and you're setting up family and career. And then the third age is you retire, and people are retiring later and later, and they live well in retirement. It's a golden age where they have not as much responsibility, but can really enjoy the benefits of what they've done in their working life. Then the fourth age is that last stage where people do have disability and require assistance. And of course that happens to a lot of people. And which part of our body is going to wear out? Is it our bones? Is it our muscles? Is it one of our organs like our heart or our kidney or our lungs? Or is it our brain? And as we're getting better at treating the rest of the body, more and more people are getting brain diseases or neurodegeneration. And so we see rates of dementia. Now there's over 450,000 people with dementia in Australia, and we expect that to be 1.1 million by 2050. So we're seeing a doubling or a tripling within about 50 years. And that's a worldwide phenomenon. Even more stark in developing countries where they have a lower base of older people. They're aging what we've done in 100 years, they're aging in a century, in a generation. So what we're interested in is people are really scared about losing their memory functions or getting dementia. A generation ago, we would ask people, what are you most frightened of? What worries you most? And it's not Donald Trump. It's not tax breaks from Mr. Turnbull. It used to be cancer. Now it's Alzheimer's or other forms of dementia. Alzheimer's is the most common form of dementia. So people are worried about this, and we see it. We've seen it in our parents' generation or our own generation, and sadly now a number of my friends have dementia or have died with dementia already. And so the good news is that about 30% of the cause of dementia is attributable to lifestyle factors, to environmental factors, something that we do have control over. Another large percentage is genetic, and currently we don't have evidence that we can do anything about that. Although there's a lot of research now on something called epigenetics, the way the environment can modify how the genes express themselves. So this is the good news story. And there have now been studies over the last 5 years or so in many Western countries showing a decreased rate of new cases of dementia. That's called the incidence of dementia. And that's attributable to difference in lifestyle factors. Looking at people born in, say, 1910 versus 1930, the number of new cases per 1,000 population of a certain age has decreased in England, in Spain, in Scandinavia, in the United States. The actual numbers of people with dementia is increasing. So the prevalence, the existing number is increasing because we're an aging population. So we might be 1 in 5 or 1 in 6 of the population now. Will be 1 in 4 of the population will be like all those people who put up their hands a few minutes ago.
So you're doing some work on a Mind Your Brain project. So can we just talk a little bit about that?
So we've been particularly interested in prevention. And so we've just started recruiting for a study called Maintain Your Brain. This is the largest, we hope will be the largest study ever done in the world, and it will all be done on the internet. And it has 4 main elements to it. One is physical exercise, and we're going to hear about that this evening. A second element is diet or nutrition, and we have a world expert on that. We're going to hear about that too. A third element is cognitive training, or in other words, what can you do to not just exercise your body, but exercise your brain to sharpen it up and keep it maintained. And Loren Mowszowski is here from that. I got it wrong, didn't I, Loren? Sorry. And then the fourth one is depression or peace of mind. So we know that depression can actually be a risk factor for dementia. And so we hope by treating depression or stress management, we can reduce that risk. So these are people, you can't volunteer for this study. These are people who are part of an existing study called the 45 and Up study. This was a study funded by New South Wales Health, and it recruited 1 in 10 people aged 45 and over in New South Wales. 267,000 people in New South Wales are in this study. They recruited them about 10 years ago, so they're now 55 and up, and we will be selecting a sample of people aged 55 to 77 and inviting them to be in this study, which will go over 3 years initially, where they will get training in the modules that they need. So we'll be doing a risk assessment and identifying what modules will help them and tailoring those modules to their needs. So this study has just started recruiting. We've sent out about 30,000 emails already, and another 15,000 emails are going out on Monday, and then mail to people who are not on email yet to join the study. Everything on the internet. If we're successful, this will be groundbreaking and will really be a platform nationally and internationally to do these sort of studies, do these sort of training, to have a population impact which will reduce the numbers of people with dementia. Because if 30% is environmentally determined, and we can just reduce those environmental risk factors by 10%, we will have 3 million fewer cases in the world with dementia right now, and many more in generations to come.
Thank you. Okay, we'll have questions through the evening, so just write them down and we'll come to them. Now introduce...
Could I just mention a couple of things?
Yeah.
So Ruth, I don't know if you can put those other slides on. Yes, please. No, one at a time. So I just wanted to let you know that we're looking for volunteers. No. So the 2 things I want to tell you about. We're looking for volunteers for a study led by Dr. Nicole Cochin, and I'm going to tell you about that in a minute. And secondly, we are running a free public event, a public forum called Aging with Purpose. And it's being introduced and led by Ita Buttrose, whom you'll all know. And it's looking at how you can live positively with aging, and very strongly putting that forward. The research study that I want to talk about is CogScan, and it's developed by Dr. Nicole Cochin, and it's funded by the National Health and Medical Research Council. And she's developing computerized cognitive testing that you can do at home, online, to test your own cognition. So if you're interested in that, we might put up the slides sometime. So for the forum, you do need to register. There are flyers outside on the desk. Help yourself to them. There's 100 flyers there, which may be just enough for this audience. Actually, it's a good audience. Thank you for coming. And for the CogScan, There's the flyers outside, and Nikki hopes to be here at the end of the meeting, and you can talk to her about that research. No, okay. Well, maybe we'll do it later. Okay.
We'll do it later. We'll find the tech guy to help us. Okay. Apologies for that, Henry. I'd like to introduce Associate Professor Lisa Pont, who is a pharmacist and in particular has done a lot of work in clinical pharmacology and the quality use of medicines. And having been involved in general practice for over 40 years, all of us, this audience who are over the age of 65, the Beach study showed that we would be have treatment for about 2.5 illnesses, 2 to 3 illnesses, and be on 3 to 4 different medicines. And that's very typical, I'm sure, of many of you in the audience. And with that, we are living longer and better, managing diabetes and hypertension. But on the other hand, we're sometimes overusing medicines, and particularly when you get a bit older, some of those medicines can in fact impact on our brain. So I'm going to introduce Lisa, who's going to talk a little bit about what she does and what we could do better to live well.
Thank you, Alan.
Very close.
Thank you, Alan. So as a pharmacist, one of the main roles in my world is to think about how can people live more healthily and live longer, and what role does medicines play in that. And I do a lot of work. I'm currently at the University of Technology, and I've been looking at how medicines are used, especially among older populations, and especially among those older populations that are likely to be high users of medicines, those that are in hospital and those that are in residential aged care. And what we know about medicines is while they've brought many benefits and while they play an important role in this, the extension of life that Henry was talking about, our living longer is due in part a lot to our medicines, that there's also a risk associated with every medicine that we use. And what we really want to do to live longer and live better is to get the benefits from medicines without taking all of those risks. We know in Australia that about 3 out of every 100 hospital admissions are due to harm associated with medicines. And we know that they're preventable. So if we could stop that harm from happening, then we're already having a significant impact on a number of lives. While in my research, I look at strategies to improve the way medicines are used and improve the processes around the way medicines are used. As a pharmacist, I also work on a daily basis with patients and with clients looking at improving their medicine use. And there's a range of, life lessons that I've learnt that have an important role in getting the most out of your medicines. I think that the first thing that I ever learned as a very, very, very young pharmacist was the importance of having a list of your medicines and carrying that list with you. And so that if you do need to go to hospital or you are elsewhere and need a medicine, that you've got a complete list of your medicines. There's been that many times that I've been in the emergency department and given a little handful of white tablets and asked, can I tell what these tablets are? Because we've got someone that hasn't been able to talk or hasn't been able to tell us what medications they're taking. On that list, you need to know the name of your medicine and knowing the brand name, but as well as the medicine name. So every medicine has what we call a generic name or a medicine name. And that's the universal language that doctors and pharmacists speak all around the world. And so being able to know the name of your medicine as the medicine name can be really helpful for somebody who may not necessarily know which brand you're taking. So make sure that that list that you carry has on it the brand name, but also the medicine name. Now, for those of you that like technology and those of you that are running on smartphones, there's fabulous apps where you can actually have an app that will keep your medicines list with you. And the MPS MedicineWise have a medicines list app that you can enter them on your phone, or you can go to your pharmacist and ask them to print you out a list, or you can ask your GP to print you out a list of those medicines. Make sure you update that medicines list. One of the first pieces of research I did looked at people's medicines lists over 3 months. And while we found that people kept their lists were pretty quickly out of date. So make sure that your list is up to date. The other important thing I think that we can do to get the most out of our medicines is to talk to our health professionals about them. So talk to your pharmacist, talk to your doctors about your medicines, and make sure that you make use of things like a home medicines review, where your doctor can refer you to a pharmacist who will come to your house and go through your medicines with you, and then talk back with that doctor, and together they can make decisions about what are the right medicines. You can also do a mini medicines review or a meds check or a diabetes meds check at your pharmacy. And all of these are covered by Medicare. So as long as you're an Australian resident or an Australian citizen, as long as you've got a Medicare card or a DVA card, then you may be eligible for a subsidised review of your medicine. So there's a whole range of things to make sure that you're not one of the 3 out of 100 admissions that end up for medication-related harm or medicated-related hospitalisation.
Thank you. Okay, we'll now introduce Professor Deborah Black. Deborah is part of she's a chair of Health Data Management, the Faculty of Health Sciences, University of Sydney. She also taught me to understand statistics a lot better. She uses statistics in particular to look at broad range of research she's been doing. Particularly, she's interested in the effect of extreme weather, the environment, and the impact it has on our health. So I'll hand you over to Deborah to tell us what she does with her numbers.
Thank you, Alan. I want to follow up on what Henry was saying.
Louder.
Of the... Hi. Can you hear that okay?
Yes.
Yeah, I wanted to follow up on what Henry was saying of this increasing proportion of our population that's ageing. And at the same time, we have a number of environmental stresses related to climate change. Heat has been going up, at the heat levels have been going up in the same rate. In fact, this morning I heard on television that Scotland had its hottest day ever, 33 degrees. It doesn't seem much in Australia, but it's very extreme. And associated with that is older people don't thermoregulate as well in disasters. They don't follow instructions as well. One good example is the tsunami in Japan in 2011, and I was talking to geriatricians in Japan following that. What they found amongst the older people is those people with no cognitive impairment were able to follow instructions and get out. Those people with carers and that have dementia diagnosed had carers, but it's the people with undiagnosed mild cognitive impairment that did not survive the tsunami. So that was the issue there. So the issue amongst the aging is they don't thermoregulate as well, so they don't adjust to heat. They don't, they're frail, and mobility becomes an issue. So I think it's a really important area. My research is looking at how can we ameliorate the impact of climate change amongst ageing populations. And following on what Lisa was saying, most of the people in this room probably are born between 1946 and 1965. They are the baby boomers. And the baby boomers, if you note amongst you, I've heard a few phones ringing, I've heard people looking at their devices. You use apps and you use electronic devices. You have your photos of your grandchildren on your iPads and things like that. We are going to try and develop an app, and we've got funding to do that, to help older people navigate that difficult environment. So if there's flooding, if there's heat, if they need to evacuate, we're going to use that in terms of developing that. So I think that's a really important area that we should be able to develop in terms of ageing populations. And the environment, the impact of the environment is running in parallel to the ageing population.
Thank you. Okay, we'll hand you over now to Dr. Nick Mills. He's a consultant physician, a geriatrician. He works with St Vincent's Hospital, community geriatrics, as well as working with our good Wolper Hospital as one of our very good specialists. So if you come into Wolper and you may come into one of our programs, then Nick would be one of the geriatricians to assist in planning your care. And with that, he'd like to talk about the fact as we age and we want to stay healthy, we have to plan our care. That's part of what he does. And also, how do we do some things that we can age well? So as a geriatrician, he's going to give you some advice.
Thanks, Alan. So I guess the first thing to say is that I think traditionally aging has been seen as something that needs to be avoided at all cost. And I think that's really something that we need to change as an attitude amongst all of society. And I think older people have a huge amount to contribute to society, probably more than they've ever been given credit for. But the way that we need to promote that is probably by ensuring that older people do age well, and their aging and that third age that Henry spoke about is done in a quality way. What we know about and is that your midlife really has an important role to play in how you age. And some of those things that were touched upon in midlife, and there's been some really good evidence actually just come out in the last 2 weeks about being active in your midlife and what an important role that has to play actually in how well you will age as time goes on. There's a number of things you can do as you age to ensure that we avoid this big thing called frailty, and it's a bit of a complex phenomena, frailty, but it basically means the accumulation of disabling conditions as you age. And that accumulation of conditions means that the time, that third age, can be difficult for people. So my big advice, and what I spend a lot of time with my patients talking about, is how to actually promote healthy aging by promoting those things that we can actually avoid. So simple things like talking to your doctor about your blood pressure, talking to your doctor about your cholesterol, talking to your doctor about your blood glucose, so preventing diabetes and treating these things, is actually very important. And it starts early. It's not something to be avoided or something to put off. The other thing we need to think about, and I think that the important thing about the baby boomers coming through, is they're going to be much more empowered, I hope, to take hold of their own health and really promote their own health and not be so reliant on health practitioners to really tell them what to do. So I encourage you all to really feel empowered to take control of your own health. Cancer screening, so there's a number of cancers in population-based screening that we should all be aware of. So for females, breast cancer screening with mammograms is very important. Cervical cancer screening is important. For men, prostate cancer screening is important. And for both men and women, colon cancer screening is very important. So just having a think about those things and having these discussions both at home, with your family, and also with your health practitioner is very, very important. So I would highly recommend that. So I guess that's the more medical things. Beyond that, we've touched on diet and exercise, which I hope we will talk about a bit more tonight, and about what an important impact that has to play on healthy aging, and how we can promote that and some of the programs that are available for you all to be able to participate in, particularly exercise programs, and the benefits that has on a whole range of diseases and preventing disability right through into older age. And then also talking about how we promote social engagement amongst people who are potentially at risk of social isolation, which is very important, and actually checking in with ourselves and our loved ones about how we actually do ensure that we are socially engaged on a constant and regular basis. Spirituality is very important, and making sure that there are areas in our lives that we are gaining enjoyment and that joie de vie that can come from activities and hobbies. And I also think that the cognitive engagement is particularly important as well, about making sure that we continue to use our brain right through into older age. So I think that using some of these strategies of healthy aging, we can promote that third age as being an incredibly productive and worthwhile time that we can still give a lot back and still have a great deal of enjoyment, and it's not something to be afraid of.
Thank you. So Professor Brodaty, you wanted to put up that slide just to talk to that? Okay, there you go.
Thank you. So you can read that. So this is what the testing looks like. And most testing, people go to see neuropsychologists. They want detailed testing of their memory and other thinking functions, so-called cognitive functions. And this takes about 3 hours. Can cost between $1,000 and $2,000. Is that right, Loren? About that? Yeah. Takes a lot of time for the psychologist, because after the 3 hours of testing, they then have to score the test and write it up. It's 5 or 6 hours of work for the psychologist, and 3 hours of really can be stressful testing for the person undergoing the testing. If this is shown to be effective for the majority of people, then it may be a way of circumventing some of this. and people being able to do the testing in a more relaxed way and not feeling as stressed, and also being quite economical. And for research, it would be a great boon. So this is what the testing is about. And if I go to the next slide. So if you would like to be in that and volunteer, these are the criteria. You need to be 60 or older. You need to be fluent in English. Need to have any experience with computers is welcome. And if you do volunteer, you'll be asked to complete questionnaires, an interview about your general health, do some computerized tests on an iPad, and do some face-to-face testing. So we can compare traditional testing versus computerized testing. So whatever Julie's got, Karen's got too. She's not here tonight. She's also ill. But you'll be able to get information on the desk. There's some flyers, or we're hoping Nikki Cochin will be here at the end of the meeting and you can ask her questions. Then the next slide, please. And we can just leave this next one up. So this is the Aging with Purpose. And the bottom of the slide is cut off, unfortunately. So is there another slide that follows this? No. Ah.
But there's registration.
Yeah, there's a flyers at the front, and so help yourself. It's on October 31st, a Wednesday morning from 10 to 1 at the Juniors at Kingsford. It's free. You get a morning tea. There'll be dancing. There'll be Ida Buttrose. There'll be fun, and there'll be informative. And please come and tell all your friends about it. And you need to register, and registration details either by telephone or email, and they're on the flyer which is at the front. Thank you for giving me the opportunity to tell you about these events.
Thanks very much. So now we're going to get how do we feed our brain, and we now have a couple of experts from the floor here to improve our brain, our health. First one is going to be Sue Radd. Come up here and talk to us, Sue. Please invite Sue up here. Thank you. Everybody applaud. Thank you. Now, you're an advanced accredited practicing dietitian, and you've also been involved in nutrition for many, many years, as well as writing some wonderful books. And there's a very big book that she's written called Food as Medicine. So let's talk about some of your tips on healthy aging and some of the foods that we should be eating.
Good evening, everyone. Good evening. Okay, so I've just been asked to provide a few general tips. The first tip I would provide is to cook at home more. One of the most consistent findings in research is that people who cook at home more, regardless of what dietary pattern they follow, have much healthier diets. They eat more of the right stuff. The second tip I'm going to give you is to try and adopt as much of a plant-based dietary pattern as you can stand. It doesn't necessarily mean becoming vegan for everyone, but it could mean adopting a traditional style dietary pattern, whether it's traditional African or traditional Asian or traditional Mediterranean. And the Mediterranean diet excuse me, is the area that I have a particular interest in and that we're going to be using in the Maintain Your Brain study that Professor Brodaty mentioned. Because of all the different dietary patterns that have been researched, it has more evidence behind it, really, than anything else. And when it comes to healthy aging, we already know that people who stick more to a Mediterranean dietary pattern, in other words, they eat lots more vegetables, fruits, nuts, legumes, and lots of good extra virgin olive oil, and eat less of foods like red meat, sweets, drink sugary drinks, less of those things. Those people actually have significantly lower rates of heart attack and stroke, lower rates of diabetes, type 2 diabetes, lower rates of fatty liver, and the list goes on and on. But the next frontier, has been alluded to, is the brain. And what we know thus far on the brain is that people who stick more to this plant-based dietary pattern, based on observational studies, actually tend to have slower cognitive decline as they age. And it could be a difference of about 4 or 5 years, according to the observational studies. Not only slower decline, but we have seen in these observational studies that these people are at much lower risk of having developed Alzheimer's disease, in particular, mild cognitive impairment, which has been mentioned, and converting from this MCI, the mild cognitive impairment, to Alzheimer's. And even if you have Alzheimer's disease, the data suggests that these people are at lower risk of dying prematurely. And most recently, apart from looking at cognition, so thinking and memory, a few of these larger population-based studies have shown that higher adherence to this Mediterranean dietary pattern is also associated with lower shrinkage or less shrinkage of the brain as we age. So now they're getting into actually measuring the size of the brain, measuring the volume, and they can measure the whole brain or measure the grey matter or the white matter and even bits of the brain like the hippocampus, which is particularly important to your memory function. So where we're at with that now is to undergo the clinical trials, and there have been a few, and recently we conducted a systematic review looking at all the clinical trials in the world, and the best one by far is one that was conducted in Spain, and this study showed that over an average of about 4.1 years, people that stuck to a Mediterranean diet supplemented with at least about 4 tablespoons of extra virgin olive oil a day. Yes, not teaspoons, not sprays, but tablespoons, or a Mediterranean diet with a good handful of nuts every day, actually had a slowing of cognition, cognitive decline compared to people that were, say, on a healthy but low-fat diet. So lots of potential good news, but it's all pointing towards a plant-based dietary pattern. So eating lots of those plant foods, unrefined plant foods, it's not just the absence of meat, but getting those fibres in, because the fibres are crucial to feeding your hungry microbiome. And literally after every single meal, you are either healing yourself or harming yourself. It happens that quickly. And this is where, this is something that we've only discovered in more recent years, that it's not, doesn't just take decades. It takes decades for us to see the effects, but every meal makes a difference, because after every meal there is signalling between your gut and your brain and your gut and your liver and your gut and everything else, including your immune system. So eating these plant-based diets with much higher fibre content, as well as the phytonutrients that have antioxidant, anti-inflammatory properties, seems really important to healthy ageing.
Okay, now you've also left some little booklets or flyers out the front there.
Yes, we have some free recipes at the back, and they are samples of recipes. At the top. They are some of the samples from my latest cookbook called Food is Medicine, which we were thrilled to find out not long ago won Best in the World for Health and Wellbeing category of cookbooks. So that was pretty exciting for an Aussie book to make it at that level. So you're welcome to help yourself to those. And if anyone in particular is keen to get more hands-on training, actually at my private clinic, it's a little bit down the track in Castle Hill, we actually run culinary medicine cookshops. So they're an event where you can learn in much more practical way how to do it. Not just be told what to do, but show me how to do it. And we have a lot of health professionals that come to that, as well as consumers. So lots of ways to help yourself.
Thank you.
Thank you.
Thanks, Sue. So that's food as medicine, cooking for your best health. Okay, now we're going to feed our brain, and we talk about doing Sudoku and crosswords. So Loren is a young person, yes, clinical neuropsychologist and a mother at the University of Sydney's Brain and Mind Centre, and she's been evaluating interventions that might help our brain to sort of stay young. So I'll hand you over to Loren. Thank you, Loren.
Thanks, Alan. Hi, everybody, and thank you for having me here tonight. Hopefully I can add to the information that you've already had, which has been wonderful. So my area of work is as a clinical neuropsychologist, which means that I focus on those thinking skills that have been mentioned here already, things like memory, the speed of our thinking, our reasoning, all those sorts of things, and how those skills might change as we get older. So my research really looks at, as some others here have said, what are the factors that can add to the risk that those thinking skills might change as we age, and what are the protective factors that can help us to either improve those thinking skills or maintain them as we age. And a big factor of my work looks at something called cognitive intervention. So have any of you heard of brain training? Yep. It's a bit of a buzzword at the moment. It's a very hot topic, partly because it's become quite a commercialized area with things like Lumosity, Nintendo Brain Trainer and programs like that. The basic premise of brain training is that we're trying to exercise the brain. We're trying to improve the connections between the various brain cells, and in doing so, strengthen the way that they function. There are lots of different ways that we can do that, and certainly using some of those computer-based programs is one way. There is some pretty good evidence to show that in older people who don't necessarily have cognitive problems, as well as those who may have some early stages of cognitive change, those people with mild cognitive impairment, as we've heard already, we have some pretty good evidence to show that those computer-based programs can be quite effective. And what they're doing is giving you an opportunity to repeatedly practice different types of cognitive skills. So let's say it's a memory task. They give you an opportunity to repeatedly practice that memory skill, and so on. But we don't really know whether those benefits that we see on the memory tests that you do before and after those computer programs can translate to benefits in an everyday sense. So we're yet to find out whether doing those online computer programs will help you to remember the items that you need to buy when you go to the supermarket, for example, or remember your neighbour's name who you recognise but you just can't quite get their name, which happens so often. So we're yet to find those benefits, but nonetheless, as I say, we do have pretty good evidence to show that those programs can be effective. I will say, though, that they're not the be-all and end-all. There are lots of other ways to exercise your brain, and really what we're looking at here is just finding different things that can stimulate your thinking. So here we're talking about anything that's going to challenge your brain, whether it's taking up a new hobby, learning a new language, taking up that gardening or landscaping project that you've always had in the back of your mind, even learning a musical instrument. Things like that are really going to challenge your brain, and that's the key. Not only keeping mentally active, but doing something that's going to push you out of your comfort zone from a mental perspective. And really this third age that we've been talking about is the perfect opportunity to do that. So as Nick said, it's very much about taking control of your own health and creating those opportunities for yourself to do that. Looking at your local council, community programs, various courses, University of the Third Age, Probus clubs, all those kinds of things that can give you that opportunity to stimulate your mind. And also a key factor is to increase your social engagement. And Nick talked about this too. Oftentimes embarking on some of these cognitively stimulating activities gives a really great opportunity to go out there and meet other people, have interesting conversations, and expand your social networks too, which is so important from a cognitive perspective, but also when it comes to feeling well and feeling happy and maintaining your mood and protecting against things like depression as well. So the key message from me, I guess, is that really try to take an active role in stimulating your brain, whether that's through a computer-based web online program, whether it's through a new activity, a new hobby that you take up. Certainly Sudoku and crossword puzzles are good because they are stimulating your brain, but what we often find is that people who do crossword puzzles are also people who like reading or who are verbal people. And to those people, I say, that's wonderful, but pick up the Sudoku as well. In other words, do something that you're not good at, and that's where you're going to challenge your brain. So try and step outside of your mental comfort zone, and that's where you're likely to see the benefits for your cognition.
Thank you. So we've been exercising our gut, we've had good food, we've exercising our brain, so now we're going to exercise our body. So I'm going to hand you over now to Cody Kane, who's our Chief Physiotherapist at Wolper Hospital, and we've been running the Move Well program. I've had a hip and a knee replaced and he got me going, so I think we should listen to what Cody has to say about exercise and moving well.
Thanks, Alan. Thanks for the opportunity to talk too. So I see a few familiar faces out there. I guess the things I wanted to talk about first is with Wolper and the programs that we run there. So we originally started with the sort of hydro classes, the aqua classes, which were really popular. And then we've sort of evolved into the Move Well program, which you've all got brochures there for. So with the Move Well program, you'll see the different names such as Move Strong, Move Steady, things like that. And that's all based around strength, mobility, falls and balance. There's back classes. And then we've actually become a little bit more holistic in the sense that we've started some Tai Chi classes as well. And I think the thing with the classes is the best practical advice. We're getting lots of great information here on the research. There's lots of practical things that people need to do as we age and what family members can do. It's quite interesting talking to an audience about motivating people when it's hard enough to try and motivate my own family to do something. But the thing with motivating people is often at the hospital we're in a perfect environment that people have had a health issue, they've had a health scare that has then promoted them to get the motivation to perform exercise. And as Nick and other people have mentioned, that's kind of behind the times. We've had that scare, we're not preventing something. We need to sort of look at it from a different angle and be there beforehand and promote those other things, get involved in the programs, get moving. And often there's lots of statements out there and guidelines about what we should follow. We should do so much exercise on so many days of the week. And to be quite honest, a lot of it's unrealistic for a lot of us to maintain. And that's what causes us to either drop out or not sign up in the first place. So what we need to do with loved ones or with yourself, one day a week is more beneficial than nothing. If you're consistent with that over a period of time, you will notice other benefits as you do that. At our facility, when people come in, it's something we work on with a lot of our staff, that you need to treat the patient in front of you. You need to tailor it to them. Because let's be honest, when some people go to exercise, they come to speak to other people. If they get exercise as well, that's a bonus if they get something out of it, but it's a social outing. It's something different. And what we should be doing is we should be encouraging that, because that's a starting point. If they enjoy the social aspect of it, then they might learn to like the exercise component. Then the exercise component might then grow into twice a week. And then if you're doing it twice a week, it might grow. But the same issue I tend to find happens in younger people, that they sign up to a gym and then they think, I want to get fit, I want to do such and such. 5 days a week they go to the gym for 3 weeks, and then they pay their membership for the rest of the year and never attend again, okay? It's just unrealistic to continue to do that. So I think the main points to take away are, once a week, anything is better than nothing. You've got to start somewhere. Today's the day to start. Luckily, all our programs are just starting fresh, so you can sign up. You can sign up through the brochures. But with all of that, that 1 day a week, that starting now, starting something is the way to go. And I also think the challenge. So a lot of people walk or walk daily, which is fantastic. With walking daily, I always think that our bodies are inherently lazy. We look for the most efficient way to do something. So if you're walking, you'll walk the same path every day, so that's great. Your body will get used to using the least amount of fuel to walk that path. You'll do it as efficiently as you can. So that's where the classes and other things you may attend give you a different type of challenge. Challenge your body in a different way so that you'll get other benefits on top of that. And I think the last point to touch on is, as I've mentioned, the social aspect. It's something that's not considered, and it's a lot of work that we do with our staff since we've sort of had more of the geriatric rehab come through, is getting people to come along, chat, get the friendly nature, the social interaction to help their memory, help their cognition, because they're important benefits and they're important things to help prevent in the future. And I think that's the key message, that we need to move a little bit more towards prevention rather than waiting for that health scare to happen. And programs such as we run and other centres run are a good place to start. But even for yourself, if it's just one day having a small walk or something like that, there's plenty of benefit in that as well.
Thank you very much. Okay, so before we go to the audience for questions, I'm going to get you to all stand up because you've been sitting here for an hour, and I want you to shake a bit and stomp your feet a bit and do some exercise, a bit of a wriggle. Okay, and now you've had a chance to think about what questions you're going to ask. I'm going to ask you to sit down quietly, and we'll have question time. So we have some roving. You have one of these. This one. Okay, who's going to be first question off the list? Lady over here, thank you. Got to get over. Can you go over there, Ruth? In the mid, right in the middle.
What a good idea to stand up. Got muscle trouble.
And you can direct them to whomever you wish in the panel. And Ruth is going to stand there next to you. There's Michelle around there as well. Where's Michelle? Up there. You've got a microphone up the back, so we get the back people as well. Okay, you ask the question. We're not going to let go of the microphone.
Ready?
Yep.
I want to talk to Bronwyn. My name's Danielle. Hi.
You've got to shout. Tell us who you'd like to speak to.
To Bronwyn about the Tai Chi and the dancing and that, the rumba. And oh, okay.
Burgess Centre doing exercise. Is that what she's talking about?
She'll come and see you after.
Okay. Next up the back, Michelle.
Bruce here. I'm a medically trained guy, and I've noticed that sight, sound, touch, taste, and hearing deteriorates, some more than others. But there's more. There's balance. There's limb position, and there's nasty bowel and bladder. Short-term call. Please discuss.
Henry, have a go. Okay, geriatrician will answer the question.
Really, really good question. So, I mean, I can touch on a few of those things. First of all, you mentioned sensory. I think paying attention to your senses and the deterioration as you age is actually really important. So, particularly eyesight and hearing we can do lots about. Unfortunately, older people become a little bit stubborn and become in denial about their sensory. Yep, we'll get big nod there. So I think it's important that we have those conversations with our loved ones about actually addressing those issues, because that can make a huge difference for cognition. So if you can see better, if you can hear better, you will often think better. Now, to touch on balance, we know particularly for falls. So I admit patients into an acute hospital over at St Vincent's. 1 in 2 of the patients that I admit probably present with a fall and some sort of injury. And we know that balance particularly, as well as limb strength, is very important to prevent falls. And falls in the elderly is a huge cause of morbidity in our society. So you fall, you hurt yourself, you end up in hospital, and then bad things start to happen to you. The thing with falls, and particularly the balance and lower limb strength, is that you need to work it constantly. It's not something that you can go to a program for a week or 2 and then think it's all fixed. So it's something that all of us need to constantly work out throughout our lives if we want to prevent it. So I think that's what I'd say about balance and limb strength. Finally, bowels and bladder. Look, it's not an easy subject. There's often multiple causes of why people have problems with their bladder and bowels, but there is a lot that can be done about it. What I would suggest you do is having a conversation with your GP in the first instance if you've noticed something. It can be, particularly bowels, can be as simple as dietary. So particularly constipation is a very prominent issue in older patients, and the intake of fibre, which we have mentioned already, is incredibly important for bowel health. And fecal incontinence can actually be a result of that.
May I just add a bit more, please?
Sure.
It's a short time between getting a call to urinate or open your bowels and it happening.
Yes.
I mean, I'm approaching 80, and it's very worrying. Maybe Professor Nash with her pharmacology can help. I don't got any help, please.
I think you're going to need a consultation after that. Good questions, and I think for many people they'll want some answers, so certainly you can get referred to a geriatrician to discuss those matters. Any other questions up the top there? Yeah, over there. Michelle, second, third row there, just hang on, you're right, Bruce. Michelle's going. I think while we're talking here, Linda Cummins is here, she's our nutritious dietitian at Wolper. What are some of the things that you feel you can achieve with patients when they're in hospital that maybe they're not doing at home? Just a couple of tips.
Hopefully, if any of you have actually been into Wolper, you realise that our food that we offer at Wolper is hopefully famous in the eastern suburbs. We provide an experience of what it is to eat healthy within our hospital. We have often 10 to 12 serves of vegetables every single day. We have a variety of often 19 different vegetables or fruits every single day. Vegetables and fruits that you may not eat at home, and we know that variety is really important. Every second main meal within our hospital is legumes or lentils or chickpeas or beans, and we know that they're very healthy and plant-based. And we also know that we use a large amount of herbs and spices in our cooking. Not hot spices, not chili, but tasty spices to help stimulate your appetite. And also lots of herbs because of the phytochemicals that are in them and to make the food taste better. Thank you.
Okay. Michelle, up the back here.
Can I just make one quick comment and then a question? The comment is that as much as we try to use our brain by doing crosswords and that, there are quite a few professionals who have landed up with dementia who are using their brains all their lives at a very high standard, and there doesn't seem to be an answer for that.
There are indeed, and I've seen some of them. And you can do all the right things. You can exercise, you can eat the Mediterranean diet, you can use your brain constantly, you can be socially active and still get dementia. None of these things is going to protect you definitely. They are protective factors, but they're not guarantees. And they may be, in fact, delaying the onset, but not actually stopping you getting it. And so we maybe, if we all lived long enough, we would get dementia. We don't know. The oldest person in the world that's been documented was 122 when she died, and she was tested a year before she died, and she didn't have dementia. In our study of centenarians, of 400 centenarians, about half have dementia and half don't. So there is no guarantees in life. But the people who do all those things are less likely to, or are more likely to get them later than they would have if they hadn't done them. So we're trying to delay the onset of cognitive decline, ideally till after we die.
Okay. My question, thank you, is to Dr. Mills. I just wanted to know, how close is delirium to dementia?
What we know about delirium is that it's probably an indication of a vulnerable brain. So there's probably some underlying vulnerabilities there when somebody has a delirium. And depending on the level of insult that causes that delirium, so very commonly in older patients with vulnerable brains, an insult can be as simple as constipation, for instance, we mentioned, but also simple infections such as respiratory tract infections or urinary tract infections. And that's an indication that their brain is vulnerable. And it's probably what we know is one of the risk factors that that person either has underlying dementia or is going to develop it in the future. So that's to say, but they are very distinct entities. A delirium is something that is caused by typically a reversible pathology, so something that can be reversed, and it typically comes on very suddenly, and it often involves a change in conscious level, so people become either very sleepy or hyper-aroused, and as I said, it typically is reversible. So they are two distinct entities, but certainly delirium is a risk factor to know that you have an underlying vulnerable brain.
Yeah, delirium could happen, unfortunately, getting older. You have an operation, and in that post-anesthetic phase, you're not thinking clearly, you're imagining things, you may be hallucinating and doing unusual things. So that, and I'm sure that some of you know people who've gone and had that experience. Any other questions up?
Can I just ask, does it stop after a period? Do you get rid of it?
So most commonly it does. The duration of it is highly variable. for individuals, okay? And it really depends on what the insult is. Some deliriums I've seen deliriums carry on for 6 to 12 months in severe cases. What we also know is every time you have a delirium, your cognition also probably declines even after it has resolved.
Thank you very much.
Thank you for the question. Thank you.
I just wanted to ask the question, is there any potential correlation between statins and peripheral neuropathy?
Okay, the pharmacist. So the issues is statins, which a lot of people are using to lower their cholesterol, and those things can cause other problems. We know that.
Yeah, and I think you've picked a really nice example of a bigger question, and that's that every medicine has benefits and every medicine has risks. And while we know that for most of our medicines, most people benefit from the medicine, we also know there's a very small number that will experience some of the risks. And hopefully, or generally, it tends to be a very low number. We tend to be talking numbers like 3 out of 100, 10 out of 100 is a very, very common risk associated with the medicine. So we're talking very small numbers. But statins have been associated with a wide range of risks, of which peripheral nephropathy is one that has been associated. Probably the most common is muscle myalgia or a muscle weakness. And I would suggest to anyone that has an unusual sign, symptom or feeling to raise the question with your doctor, could this be a medicine? And you don't even have to be certain. But sometimes the relationship's not really clear. You know, statins for our cholesterol can make our muscles ache. Medicines for our blood pressure can give us a cough. And so they're not always things that you would logically put together. So if you think that you could possibly be experiencing one of the risks, then it's time to talk to your doctor and see, is this likely? And what are the alternatives? Because there's certainly alternatives, and you need to weigh up the benefits of the drug versus the risks of the drug.
Just to mention that statins are the most commonly used drug amongst older people, Australians. Peripheral neuropathy is a very common condition, and Nick can probably speak better on this than I can, but a lot of cases peripheral neuropathy, which means loss of feeling or unusual feeling from the nerves, and it's in the periphery, usually in the legs, in the feet. About 50% we never know what the cause is. So just because you're on a statin and you get peripheral neuropathy, you can't say that's caused it, but it might have. And often we never know.
Okay, we left Deborah out here. So what are some of the things we might be able to change in the environment that we could, maybe 3 or 4 things that we should be looking at, just close up. Close up.
Yes, the things that you probably want to look at in the environment is that you don't want that environment to prevent you from going out and exercising. So you need to be able to, exercise and socializing are what you need to do. But if you feel that you are at risk because of heat, because of various disasters, that opportunity to go out and interact with the environment. So the key things that you should be looking at is you should be aware of what the weather is when you go out. You should be aware of being able to opportunities to use transport and to visit family and things like that. So you make sure that there is no environmental. We had the issue of the asthma outbreak in Melbourne, and the effect of that was another environmental, which impacted on older people as well. So it's a matter of being aware of what the environmental things that are happening outside that can impact on your health.
Okay, thank you. Any other questions? Over here, yes, sir. Michelle's coming down.
Thank you. Thank you for some excellent presentations. All the speakers, I think, spoke exceptionally well. There's so many topics that could be raised, but I just thought I'd start with the final thing that Dr. Schell got us all to do, which was to stand up. I think it was probably the most important lesson that we could get, maybe, because there's a saying that sitting is the new smoking. That of all the factors that impact a person's health, sitting seems to be, according to some information that I've come across, the most critical and can impact more than anything else. That if we sat down less and we stood up more, of course we have to move as well. But I'm just saying, even the act of just standing rather than sitting, or not sitting as much, is crucial. The other thing I just happened to notice when somebody was taking a drink, and it occurred to me that wasn't mentioned either, and that's hydration and water, the importance of adequate hydration. And we spoke about nutrition, exceptionally important, but hydration goes along with that. With regard to movement, I just think if I could just add to the standing and sitting, there's a concept I've heard called prehabilitation. We talked about prevention, we have rehabilitation, but I've come across this term prehabilitation, and maybe that's also ties in with what was spoken about with all these Move Well and all these other programs, the idea that we have to look at this idea of prevention. For instance, in martial arts, I believe the first thing you're taught in martial arts is how to fall correctly. You know, the idea falling is inevitable, and the idea is not to prevent, not only to prevent the falls, but to know how to fall correctly. So I don't know, at what stage this could be taught. Maybe for certain elderly people, maybe it's not practical, it's not useful or helpful, but maybe in an earlier stage it could be. But that's just some of the points that I could maybe address to everybody, if they can like to comment on any of those. Thank you.
I think the one is that for younger office workers, it has been shown that a standing office has been more healthy than people just sitting down all day. So that's a fact. And certainly, if you're sitting down and doing things for more than an hour, as we did, you should be getting up and walking around for a few minutes. That is, get up and move around, so move well. And therefore, that is also going to reduce your opportunity to fall, I guess. Okay, any other questions? Thank you for the comments. Down the front, yes? Cody.
I sort of touch on a couple of things. The standing up, definitely a great point. And I think that comes back to we underestimate the smallest bit of exercise having a benefit. We always think we have to do so much exercise to get any benefit, but we need to start somewhere. So standing up is, of course, a great starting point. Standing up and then doing some form of exercise then starts to get more benefit on top of that. And a little differentiation between prehabilitation and prevention. Prehabilitation is more based around preventing something that you think may be coming up. So a particular type of surgery you might be referring to. Whereas prevention in this sense, there's cardiovascular health, there's mind health, there's these other things that we do exercise for. We don't know what particular thing it may prevent, but by doing exercise and doing these things, you may prevent one of these other things actually occurring.
Thank you for reminding us about the importance of hydration. I just would like to add to that. Traditionally, in all societies, water was the original drink, and it's been completely forgotten. We now know, based on observational studies, it's really important if you want to reduce your risk of bladder cancer and heart attacks and strokes. And one study in particular that first showed a relationship between adequate water intake and low risk of heart attack and stroke was the Radd-Vagenas Health Study number 1, which included more than 35,000 people tracked for a good 20 or so years. And they showed that the type of fluid you drink makes a big difference, and it has to be plain water. It can be filtered water, but you can't count tea and coffee in that. So often you will hear, have 6 to 8 cups or glasses and everything counts. But what they showed in this study, there seemed to be something really important about 5 glasses or more per day of pure plain water, because people who consume that compared to those who consume much less, say 1 glass a day, had like a 50% relative risk reduction in having heart attack and stroke. So pure water has been the forgotten food, the forgotten drink, and we really must get back to it. And the other very quick thing I just wanted to mention, I'm sorry if I'm blocking you, for people who, going back to the statin question, there are quite a few people of the last 10 years at least that have come to my clinic that say things like, My cholesterol's elevated, the GP's threatened me with a statin, I don't want to take it. Is there anything I can do? And it's a really common question. And years ago, the research suggested that if you adopt a low saturated fat, low cholesterol diet, that was helpful. However, down the track, we've realised it helps a bit, but not that much. It really, on average, reduces your cholesterol by about 5%, so nothing to jump up and down about. But in the last 10 years, there's been a really interesting approach from the University of Toronto. Professor David Jenkins, who some of you may know his name, he's also credited as being the father of the glycemic index concept, sort of well ahead of his time in many areas. And he's developed this concept of the portfolio diet. So this is a research diet, dietary pattern. It's plant-based again, and it includes a portfolio of different plant foods, like the nuts, like viscous fibres that you get from legumes and so on. And they've shown, and they've been studying this diet for a good 10 years, both in a metabolic situation and in free living conditions. And they've shown that you can lower your cholesterol, your total cholesterol, by up to 30%, which really starts to rival a first generation low dose statin. And that's really exciting because the only side effects of the portfolio diet are a drop in your blood pressure if it's elevated, improvement in your bowel function, but you don't get the aches and pains in your muscles. So there is something you can do that's much more effective than the old-fashioned low-fat, low-cholesterol diet. And usually it's because people aren't eating enough of certain protective foods, which are included in this pattern.
I might just touch on hydration very quickly, which is a very important point, and that's alcohol intake. Living in the eastern suburbs, I see a lot of people who do drink too much. So I think that's one very important point about healthy aging, is knowing about your alcohol intake and being realistic about it. So current guidelines, just very, very quickly about alcohol, which I tend to drum in a lot, is you must have 2 days off where you have nothing to drink. Okay, and when you do have a drink, try to limit it to 2 standard drinks a night. Okay, we know that alcohol, more than that, does impact on a whole wide range of factors that can cause disability and cause unhealthy aging. So just that's my little tidbit for that.
And I was just picking up, and I know that we've spoken about statins, but I think the take-home message is not necessarily about one individual medicine. It's much more about know your medicines and realise that your chance of having harm is very small. But if you suspect that there may be some sort of harm, then to talk to your pharmacist or your doctor about it. So it's certainly not saying that any particular group of medicines is wrong for all people. We know there's lots of people that will actually benefit from a statin, and there's been a lot of work to support their use, but they're not the only solution. And certainly that chance of harm is there, but it is relatively small.
Henry, about the issue of cholesterol, and as we get older, do we need to lower our cholesterol?
I think that's a great question, Alan. I see people in their 90s in nursing homes on statins, and I say, why? Why? What are you trying to protect? And really, it's a balance between benefit and effect and the cost. Cost not in the cost of the money, but the cost of taking the drug in physical terms. So my understanding, statins would reduce mortality for people with the risk of heart disease. I think it's 1 death for 100 people have to take it for a year for 1 death to be saved over, I forget how many years. Nick might know these statistics better. 5 years, is it? Yeah. So it doesn't guarantee, again, there's no guarantees that it's going to stop you having a heart attack or a stroke. It's going to reduce your risk. And the amount it reduces, you need to balance it up against any side effects you may get. And that's an issue you should discuss with your local doctor. And Lisa wants to add.
I think, Henry, you picked on a really interesting point about that our needs for our medicines does change over our lifetime, and the needs that we have as we get older are very different to the needs, for example, in that middle stage of our life. And it's really important with medicines is to be at a regular interval thinking about, do I still need this medicine? I also see people in nursing homes that are taking medicines that have a benefit over 5 years, and if often we don't always have 5 years left of life, and so thinking about taking those medicines becomes an interesting question, or the purpose of those medicines needs to be questioned. So I think one of the things that we should be doing annually is getting somebody, your doctor or your pharmacist, to sit down and go through medicine by medicine and do I still need this medicine? What is it going to do, and what are the benefits that I expect from that medicine?
Another example is high blood pressure is a risk factor for dementia. So high blood pressure in midlife is a risk factor for dementia. But high blood pressure in late life, after the age of 75 or 80, may not be a risk factor. Obesity in midlife is a risk factor. In late life, it may be a protective factor. Things change over the lifespan, and you need to have reviews. The patient I saw yesterday is on allopurinol, Xyloprim, for gout, and she's been on it for a long time, hasn't had a gout attack for a decade or 2 decades. And she wants to know, should she come off it? She's willing to take the risk that she might have another gout attack, because she wants to get rid of some of these medications. And it's a discussion.
Okay, so I think we have certainly maintaining your brain is very important. The National Health Service in the UK has just implemented a program for GPs to look at everybody from 40 years onwards to make some lifestyle changes. So lifestyle changes, what we talked about, is to maintain your brain by exercising it with games, by doing dancing, by doing new hobbies, taking on a new language. It means that you can therefore do some cognitive training, improve, take up a new sport. Dancing is very important. Things such as physical activity particularly have been shown. Professor Singh at University of Sydney and others have shown that exercise, whatever it is, on a regular basis improves your concentration and your memory, and obviously helps you age well. So I think that we should say thank you to our guests this evening. I'm not Julie McCrossin, but I thank you for the opportunity to be in this sort of forum. We have another, thank you. We have another meeting September the 5th, which will be on my gut field. So we're going to talk about gut issues, cancers and other things, and foods, infections. So that's another topic to think about, how we can improve our lifestyle. If you're not on our mailing list, there's a form out up the top there. If you can fill that in, and we'll add you to our mailing list and keep you informed. I want to say thank you, drive carefully, and have a good evening.
able to participate in particularly exercise programs and the benefits that has on a whole range of diseases and preventing disability right through into older age. And then also talking about how we promote social engagement amongst people who are potentially at risk of social isolation, which is very important, and actually checking in with ourselves and our loved ones about how we actually do ensure that we are socially engaged on a constant and regular basis. Spirituality is very important, and making sure that there are areas in our lives that we are gaining enjoyment and that joy to be that can come from activities and hobbies. And I also think that the cognitive engagement is particularly important as well, about making sure that we continue to use our brain right through into older age. So I think that using some of these strategies of healthy aging, we can promote that third age being incredibly productive and worthwhile time that we can still give a lot back and still have a great deal of enjoyment, and it's not something to be afraid of.
Thank you. So Professor Brodaty wanted to put up that slide just to talk to that. Okay, there you go.
So you can read that. So this is what the testing looks like, and most testing, people go to see neuropsychologists. They want detailed testing of their memory and other thinking functions, so-called cognitive functions. And this takes about 3 hours. Can cost between $1,000 and $2,000. Is that right, Loren? About that? Yeah. Takes a lot of time for the psychologist, because after the 3 hours of testing, they then have to score the test and write it up. It's 5 or 6 hours of work for the psychologist and 3 hours of really can be stressful testing for the person undergoing the testing. If this is shown to be effective for the majority of people, then it may be a way of circumventing some of this, and people being able to do the testing in a more relaxed way and not feeling as stressed, and also being quite economical, and for research it would be a great boon. So this is what the testing is about. I'll go to the next slide. So if you would like to be in that and volunteer, these are the criteria. You need to be 60 or older. You need to be fluent in English. Need to have any experience with computers is welcome. And if you do volunteer, you'll be asked to complete questionnaires, an interview about your general health, do some computerized tests on an iPad, and do some face-to-face testing. So we can compare traditional testing versus computerized testing. So whatever Julie's got, Karen's got too. She's not here tonight. She's also ill. But you'll be able to get information on the desk. There's some flyers. Or we're hoping Nikki Cochin will be here at the end of the meeting and you can ask her questions. Then the next slide, please. And we can just leave this next one up. So this is the aging with purpose. And the bottom of the slide is cut off, unfortunately. So is there another slide that follows this? Yeah, there's a flyers at the front, and so help yourself. It's on October 31st, a Wednesday morning from 10 to 1 at the Juniors at Kingsford. It's free. You get a morning tea. There'll be dancing. There'll be Ida Buttrose. There'll be fun, and there'll be informative. And please come and tell all your friends about it. And you need to register, and registration details either by telephone or email, and they're on the flyer which is at the front. Thank you for giving the opportunity to tell you about these events.
Thank you very much. So now we're going to get how do we feed our brain, and we now have a couple of experts from the floor here to improve our brain, our health. First one is going to be Sue Radd. Come up here and talk to us, Sue. Please invite Sue up here. Thank you. Everybody. Now you're an advanced accredited practicing dietitian, and you've also been involved in nutrition for many, many years, as well as writing some wonderful books. And there's a very big book that she's written called Food as Medicine. So let's talk about some of your tips on healthy aging and some of the foods that we should be eating.
Good evening, everyone. Good evening.
Good evening.
Okay, so I've just been asked to provide a few general tips. The first tip I would provide is to cook at home more. One of the most consistent findings in research is that people who cook at home more, regardless of what dietary pattern they follow, have much healthier